As government officials urge us to stay home, many of you may be worried. Should I go see my doctor? I have a regular appointment. Should I still make that visit in person? Let's talk about it with Dr. Kian Vu at UCLA Olive View Medical Center. Dr. Vu, what a pleasure to have you here. We figured we'd go right to the source. Doc, is it safe for me to come see you if I've got a small complaint that I need to see a doctor about, or should I do it virtually? What do you generally suggest to people?
Very great question, Michaela. With the new stay-at-home orders in Los Angeles, I know it's confusing for everybody, but what I want people to know is definitely make sure you go to the hospital or call 911 for emergency medical care. I don't want the stay-at-home order for people to think that that's not something they should seek. So if you're experiencing emergency symptoms, now, if they're related to COVID, they could be trouble breathing, persistent chest pain or pressure, inability to stay awake or be aroused, any kind of new confusion or blue lips, call 911 or go to the hospital.
Right.
Now, certainly there are also other non-COVID related emergencies, such as choking or having severe chest pain or abdominal pressure, bleeding, severe headaches, or loss of neurological function. Let's say loss of a limb or something, loss of function in a limb may mean a stroke. Always seek a medical care if it's an emergency situation.
Got it.
Anything else, like if you got a mild fever, a cough, that could be handled virtually. And in those instances, call your local clinic, get an a virtual visit, and they can triage whether you should go to the hospital or not.
Well, I know that a lot of times, like I know the UCLA medical system, you have a virtual system where you can email the doctor's office and say, hey, doc, I've got a rash on my foot, or I've got an itchy earlobe. I'm making stuff up, obviously. Then the office can make the determination of whether let's jump on a Zoom call with the patient or whether we need you to come in. I mean, that's probably the best course of action.
Yeah, it's a great system that's been set up in facilities all across the country. Whenever you don't have an emergency situation, it's great to be able to email, call the office, any of these avenues to be able to have some virtual care. But remember, if you're experiencing an emergency, make sure you get prompt medical care.
Yeah, of course. Now, let me also ask, what about things like annual OBGYN appointments, annual mammograms, those things that we're supposed to do, or even maybe you have cancer in your family and you need to go for a colonoscopy. Should we wait on those procedures, Dr. Vu?
That is something you definitely want to have a virtual visit with a healthcare provider to see how urgent it is for you. Some of these things can be put off by a couple of weeks, a couple of months, but to know for sure, definitely have that virtual visit and have a healthcare provider tell you whether it's necessary to go in or not.
Yeah, I know that's sometimes harder to do with some people aren't proactive in their own health. You as a family member may need to advocate and get on the phone with your aging parent or loved one to call the doctor's office, and then the three of you can have the conversation together. I'm sure that happens to you a lot, Dr. Vu.
Doing a lot of virtual consultations at this time, and it's great to have the family come together and meet people virtually that I wouldn't have before, because I've had sisters and uncles from across the country Skype into the calls as well.
I love it. That's so beautiful. Let me ask you, since you've opened that door to me, how are you managing during all of this? Because you are a preeminent frontline worker. You're right in the line of fire with the treatment of COVID patients and other patients in your hospital, in your facility. How are you doing? How are you managing the strain and stress and fatigue?
I'm not going to lie, there is a big cost, both emotionally and physically, for all that. But number one, it's having the awareness that we are all going through the tough time, and then also taking on personal responsibility to show up, to stay healthy during the matter. And the more we could practice that, the more I could say, I can't control what's outside. I can't control what's going on with the virus right now, but I can control how I'm feeling. I can't control how I'm showing up in the world. And it's actually given me and a lot of people around me the ability to know that we are really resilient.
Yeah, no, you know what? I think that's one thing we're learning. And I imagine, like you, the same way we are doing here, we lean on each other, right? You lean on your team. When you're having a down day, hopefully one of them's having an up day, and you can lift each other's spirits. Dr. Vu, I can't thank you enough. This has been very helpful, I know, to me and to anybody listening, struggling with making those important and wise medical decisions, call your doctor's office, find out if you need to do a virtual visit or if they want you to take other action. And again, if you're having an emergency, do not hesitate to call 911. Dr. Vu from UCLA Medical, thank you so much for joining us. We appreciate it. And you stay safe, okay?
Appreciate being here, Michaela.
You got it. We'll call on you again. Stay safe, Doc.